If you are on GLP-1 GIP medications like Mounjaro or Zepbound, Ozempic or Wegovy, or thinking about starting one, this video is for you. These medications are powerful tools, but labs matter. Today I'm breaking down the 7 most important labs every patient should get checked so that you can use GLP-1 GIP medications safely, effectively, and intelligently, not blindly. Stay until the end to see what labs I see most commonly missed. Let's start by a brief review of what are GLP-1 GIP medications. Mounjaro or Zepbound and Ozempic or Wegovy are medications originally developed for type 2 diabetes and obesity management. Wegovy or Ozempic is a GLP-1 receptor agonist, while Mounjaro or Zepbound is a GLP-1 and GIP dual agonist. GLP-1 GIP medications help with weight loss by reducing appetite, slowing stomach emptying, improving insulin sensitivity, and lowering cravings and food noise. These medications work with your biology, not willpower. Are you currently on Mounjaro or Wegovy, or perhaps you're considering it? Let me know in the comments below. I'd love to hear about your experience. So why labs matter on these medications? Now on to the core question of why labs matter on these medications. While GLP-1 GIP medications are generally safe and effective, they do impact various systems in your body. Regular lab monitoring isn't just a suggestion, it's a non-negotiable part of safe and effective treatment. Think of your body as a high-performance car. You wouldn't just drive it without checking the oil, the tire pressure, or engine light, right? Labs are your body's dashboard. They give us critical insight into how your body is responding to the medications, whether there are any potential side effects developing that we need to address early, or if other underlying health conditions are being affected. Early detection is key here. It allows your doctor to make informed decisions about your dosage, whether to continue the medication, or if other interventions are needed. This isn't about scaring you, it's about empowering you with information and knowledge for the safest possible metabolic health and weight loss journey. GLP-1 GIP medications change metabolism. They affect blood sugar, insulin, electrolytes, kidney function, liver fat, and sometimes nutrient intake, and therefore labs help us confirm safety, personalize your treatment and dosing, catch problems early, and prevent long-term complications. If you are on these medications without labs, it's like flying blind. So what are the 7 most important labs to monitor on GLP-1 GIP medications? Number 1, hemoglobin A1C. This is the test to check the 3-month average of your blood sugar and is the most important metabolic lab to check before and while on GLP-1 GIP medications. Why hemoglobin A1C matters? It shows average blood sugar over 3 months. It helps track insulin resistance and guides dosing decisions. Even if you don't have diabetes, checking hemoglobin A1C matters. So when to check hemoglobin A1C? Definitely before starting GLP-1 GIP medication, and then every 3 to 6 months based on your results and medication response. Number 2, fasting glucose and fasting insulin if available. This test shows how your body handles sugar day to day. Why it matters? This lab helps identify hypoglycemia or low blood sugar risk, helps assess insulin resistance, and is especially important in non-diabetics on higher doses of GLP-1 GIP medications. Number 3, comprehensive metabolic panel, also called CMP. This test is actually multiple labs in one and includes kidney function test or creatinine, liver function test, also called AST and ALT, and electrolytes. Why CMP matters? GLP-1 GIP medications can affect hydration, nausea and low-calorie intake can impact electrolytes, and liver enzymes often improve on these medications. But of course, all of these markers need monitoring. So I check CMP routinely once before starting the medication and then every 3 to 6 months based on results and other comorbid conditions. Number 4, thyroid function test called TSH or thyroid stimulating hormone and free T4. Information about thyroid health matters when thinking about starting GLP-1 GIP medications. Why thyroid labs matter? Hypothyroidism or low functioning thyroid can blunt weight loss. Thyroid symptoms caused by uncontrolled and undiagnosed thyroid disease can mimic side effects from GLP-1 GIP medications. Therefore, it is very important to get your thyroid lab tested before starting GLP-1 GIP medication. Number 5, lipid panel or cholesterol. GLP-1 GIP medications often improve cholesterol, but we still need to track it. Why lipid panel monitoring matters? Lab trend shows cardiometabolic improvement and help guide long-term risk reduction. Many patients see LDL and triglyceride drop on GLP-1 GIP medications. When to check lipid panel? Before starting GLP-1 GIP medications, and then every 6 to 12 months, depending upon risk factors and other medications. Number 6, vitamin B12. B12 is one of the most overlooked lab tests. Why it matters? Reduced appetite with GLP-1 GIP medications may lower intake, and long-term B12 deficiency affects nerves, energy, and mood. Therefore, checking B12 is especially important in patients with fatigue, tingling, or anemia. Number 7, urine albumin or kidney screening in selected patients. For patients with diabetes, hypertension, or chronic kidney disease, it is important to check urine albumin or protein. Why it matters? It helps detect early kidney stress. GLP-1 medications are kidney protective, but monitoring is still smart. I'm curious to know if your doctor checked labs prior to starting GLP-1 GIP medication and then for monitoring. Let me know in the comments below, and also let me know what lab improvement you saw on GLP-1 GIP medications. So how do GLP-1 GIP medications affect these labs? Clinical trials consistently show that GLP-1 GIP medications help improve hemoglobin A1C, improve liver enzymes, improve cholesterol, and keep kidney function stable. But these outcomes depend on proper dosing on these medications, adequate nutrition and hydration, and close monitoring. Let's talk about some myths versus facts. Myth is, if I feel fine, I don't need labs, while the fact is, many metabolic changes are silent. Another myth is only diabetics need labs. The fact is, non-diabetics still experience metabolic shifts, and therefore it's best to monitor labs. Another myth is GLP-1 medications damage kidneys or liver, while the fact is clinical data shows protection with monitoring. Let's talk about some questions to ask your doctor. You may want to ask your doctor, what labs should I check before starting? How often should we recheck labs? Do I need B12 or electrolyte monitoring? And are my labs supporting continued dose increases? If your doctor welcomes these questions, that's a good sign. Let's talk about some do's and don'ts. Do's are get baseline labs, recheck labs every 3 to 6 months, hydrate and prioritize protein, and report symptoms like fatigue or dizziness or any other concerns to your doctor. Don'ts are, don't skip labs long term. Don't ignore abnormal lab results, and don't assume supplements replace monitoring. So, what is the most commonly missed lab? If I had to pick one lab most often skipped, it's vitamin B12. Low appetite on GLP-1 medications plus long-term use makes B12 monitoring more important than most people realize. Zepbound and Wegovy are incredible tools, but they work best when paired with smart monitoring. I hope this video has given you a clearer understanding of why these lab tests are so important and empowered you to have informed conversations with your doctor. Your journey to better health is a partnership, and knowledge is your greatest asset. If you found this video helpful, please give it a big thumbs up, share it with someone who might benefit, and subscribe for more evidence-based health and weight loss advice from a doctor's perspective. And I appreciate your support to help this channel grow. Stay healthy, stay informed, and I'll see you in the next one. Bye for now.